Well, COVID cases are increasing nationwide, including right here in Arkansas. Health providers are warning that even if the numbers don't show a massive uptick, it doesn't mean that Arkansans aren't getting sick. Channel 7's Ashley Lunningham has an update on what medical professionals are seeing.
Yeah, Beth, Dr. Robert Hopkins with UAMS tells me that we may not have an accurate number of COVID cases, but the wastewater is a good indicator. And the CDC is reporting that Arkansas is in the high-risk category. Arkansas health providers warning Arkansans to stay vigilant with COVID cases starting to rise. Dr. Robert Hopkins with UAMS says they have been watching the trends.
People that are calling with respiratory infections, many of them are positive for COVID. We have seen a little bit of an increase in hospitalizations. I think when I checked earlier today, there were between 15 and 20 people hospitalized with COVID at present at UAMS.
According to the Arkansas Department of Health, hospitalizations went from 67 to, within the past 7 days, 86. While reports of cases have not seen a huge spike, Dr. Hopkins says our wastewater is telling a different story.
Based on the CDC data, has the highest testing rate of positive COVID in the country. There are other regions around us that also have increased rates, but based on the last data on the 3rd, we're at the top. And so we need to be cautious.
And with school back in session, this could increase the spread.
Heard about at least one school in Tennessee and one in Alabama that have been open for less than 2 weeks. They've already had to close down because of the rate of people being sick in the schools. So particularly important for people, if you or your kids are sick, stay home.
Dr. Hopkins says symptoms vary for everyone, but usually look like a respiratory infection with fever, and usually older individuals needing to be hospitalized. He says if you feel sick, it's best to stay home.
If you're sick, particularly fever with respiratory symptoms, get tested, particularly if you have medical problems or you're an older adult. If you're not feeling well, don't go. Please do that for yourself and do that for others. Don't take a chance of whatever you have, whether it's COVID or something else, being spread to others. You got to take care of each other.
Now, Hopkins tells me that there are 10 locations around the state that have been testing the wastewater for COVID, and there should be an updated report on that coming out tomorrow. In Little Rock, on your side, I'm Ashley Lunningham.
Okay, Ashley, thanks so much. Dr. Hopkins says the newest 2024-2025 COVID vaccine should be released to healthcare providers by the end of the month or by the 1st of September.